आज की इस वीडियो में हम एक बहुत ही कॉमन कंडीशन के बारे में बात करने वाले हैं जो कि है प्लांटर फेसाइटिस। नमस्कार दोस्तों, मैं डॉक्टर संजोग मेकेवार। आई एम एन इंटरवेंशनल स्पाइन एंड पेन फिजिशियन and also the director of JVisha Spine Pain and Regenerative Hospital. So basically, what is plantar fasciitis? Plantar fasciitis, also known as the first step heel pain, is basically inflammation of your plantar fascia, which is a thick connective tissue present on the underside of your foot. Because of this inflammation in this plantar fascia, the plantar fascia has a tendency to go into spasm, and when you take first few steps after taking a good rest, you feel that piercing kind of pain in your heel. So who are the people who have the risk of developing plantar fasciitis? तो इसमें सबसे पहले आता है ऐसे लोग जिनका लाइफस्टाइल ऐसा है या वर्क प्रोफाइल ऐसा है कि उन्हें बहुत ज्यादा टाइम तक खड़े रहना पड़ता है। तो बिकॉज ऑफ दैट व्हाट हैपेंस, योर होल बॉडी वेट is getting concentrated on your heel for a very long time, and slowly that patient develops inflammation in the plantar fascia. Secondly, even if you have a sedentary lifestyle and you have muscle imbalances around the foot, like your Achilles tendon is getting degenerated, you have tight calves, then these conditions exert pressure on your plantar fascia, which ultimately lead to its inflammation and plantar fasciitis. अगर आपका वेट ज्यादा है, then again it will put extra pressure or extra stress on your plantar fascia, which will lead to its inflammation. अगर आप खराब तरीके का फुटवेयर यूज कर रहे हैं या हार्ड सोल वाला फुटवेयर यूज कर रहे हैं, दैट विल ऑल्सो लीड टू द डेवलपमेंट ऑफ प्लांटर फेशिया। मैं अक्सर देखता हूं कि लोग कहते हैं कि हम तो वॉकिंग के लिए जाते हैं, हम तो रोज रनिंग करते हैं, फिर भी हमें प्लांटर फेशिया हो रहा है। आई जनरली टेल देम, गो होम एंड सी योर फुटवेयर। अगर आप कई सालों तक सेम फुटवेयर यूज कर रहे हैं फॉर योर वॉकिंग एंड रनिंग, देन आप देखेंगे कि वो सोल एक तरफ से जो है पतला हो जाता है, एक तरफ से मोटा रहता है। These imbalances ultimately increase stress on your plantar fascia and you may develop plantar fasciitis because of basic defects in footwear. And lastly, if you have flat foot, then again you have a tendency to develop plantar fasciitis. As I said, plantar fascia helps in maintaining your arch, and if that is weak, that will lead to the development of inflammation in your plantar fascia. So if you have developed plantar fascia, then how to treat it? So at JVisha Pain Clinic, we can say that around 70 to 80% of the patients get treated with simple conservative managements. So we use the simple concept of triple S. And what is that? It includes stretch, strengthening, and support. So first we start with basic stretching exercises and stretching routines that are taught to the patients with the help of our physiotherapists. And slowly, once the plantar fascia becomes relaxed, we generally focus on developing strengths in the surrounding muscles. So if you are having a weak calf muscles, then we focus on strengthening of those muscles, which will slowly reduce the pressures on your plantar fascia. And lastly, we provide support to the foot arch. So if you are having any defects or deformities of the foot arch, then giving the simple support in your footwear will slowly reduce the inflammation in your plantar fascia over few months. Now the remaining 30 to 40% patients who don't get relief with the conservative management, or few patients who are experiencing severe pain with numerical rating scale of 8 to 10 and they are not able to walk, then we generally advise simple MIPS interventions for those patients, which includes injections of regenerative medications or low doses of steroid around the plantar fascia. At JVisha Pain Clinic, we generally do these procedures under ultrasound guidance. In our future video, I will tell you about the importance of doing these procedures under ultrasound guidance. Only very few patients who don't respond to any of these conservative and non-interventional treatment options ultimately require a very small surgery where we do the plantar fascia release and thus reduce the tension on the plantar fascia. So friends, hope in this video you understood what exactly is plantar fascia, what are the risk factors for development of this condition, and what are the available treatment options which you can use to get over this very painful condition. Thank you.